Hello, my name is Olive Maury Rich. I'm going to be performing a head-to-toe assessment on you today. Is it okay if I touch you through this exam?
Yes.
But if you'll go ahead and identify your name and birthday for me, please.
Jimmy Sides, 7/14/89.
Very good. I have just performed my hand hygiene, so we're going to start that assessment. I'm going to go ahead and look at your head first. It is symmetrical and in midline position. Throughout this exam, I'm going to be looking at your skin, looking at the color, the temperature, the texture, the turgor, the moisture, any type of bruising, edema, lesions, scars, or nevi. So now I'm going to go ahead and palpate your head. I'm looking at your hair distribution, hair color, hair texture, and for any infestations. I'm feeling for any masses, tenderness, lesions. I don't feel anything, and let me know if you have any tenderness throughout this exam. I'm going to go ahead and palpate that masseter muscle, which is cranial nerve 5, trigeminal. If you will clench your jaw for me, very good. And then we're going to palpate the TMJ. If you'll open and close and move side to side. Okay, no subluxation or crepitus noted there. I'm going to go ahead and check the other part of your cranial nerve 5 for your sensations. If you'll close your eyes and tell me where I touch your face.
Forehead, nose, cheek, chin.
Very good. Now I'm going to go ahead and palpate your lymph nodes. We'll start with your preauricular, your postauricular, your occipital, your tonsillar, your submandibular, your submental, anterior cervical, posterior cervical, and supraclavicular. Any tenderness there?
No.
Okay, let's check for cranial nerve 7, which is facial symmetry. If you will smile, frown, raise your eyebrows, puff out your cheeks, and pucker your lips. Very good. Okay, now we're going to move on to your ears. Of course, I'm inspecting and looking at the shape and the position of your ears. I'm going to go ahead and palpate the tragus and the pinna for any masses or tenderness. I'm going to look in with my otoscope. I'm going to pull out and up. And I see a pearly gray translucent membrane with, since it's on the right ear, your cone of light is at 5 o'clock. Up again. And I see a translucent pearly gray membrane with the cone of light at 7 o'clock. Now we're going to check cranial nerve 8, which is your vestibulocochlear, which is your auditory. So the first thing we're going to do is occlude this ear. I'm going to repeat, and I want you to repeat the phrase.
1, 2, 3.
ABC.
ABC.
Okay, now we're going to do the Weber test for lateralization. If you will tell me which ear you hear it in or both.
Both.
Okay, and now we're going to do the Rhine test. Tell me when you hear the vibration stop. And I'm going to do it on your masseter bone, mastoid bone.
Now. Now.
Okay.
Now. Now.
Very good. Air conduction is greater than bone conduction, which is a normal finding. Moving on to your eyes, looking at your eyebrows, your eyelashes, your palpebral fissures. I'm going to pull down on your, look at your sclera and your conjunctiva, which is nice and white and pink, which is normal. Looking at the color, any type of masses, lesions, or discharge, and none of that is noted. We're going to check cranial nerve 2, which is your optic nerve. If you will hold this at arm's length, cover one eye. Cover that eye right there, and then read the lowest line you can read.
DEFPOTEC.
Very good. That is 20/20. Now switch. Cover this eye.
DEFPOTEC.
Okay, and that one's 20/20. Now we're going to check your peripheral vision. So look at my nose and tell me when you see my fingers come into your field of vision.
Now. Now.
Okay, very good. We're going to check your EOMs, which is cranial nerve 3, oculomotor, cranial nerve 4, trochlear, and abducens, cranial nerve 6. So if you look and follow my finger, follow the finger with just your eyes. Very good. And if you will follow the finger in, and then look at the wall, and then look back at my finger. Okay, that was checking accommodation and convergence, cranial nerve 3, oculomotor as well. Now we're going to dim the lights so we can do the other part of the exam. If you will look at the wall, and I'm going to check for direct and consensual response. Okay, that pupil constricts, and then the opposite pupil constricts. That pupil constricts, and the opposite pupil constricts. So your pupils are equal, round, reactive to light, and accommodate to direct and consensual light. I'm going to go ahead and look at the red reflex. So I see that, and I'm following that into your optic disc. Okay, very good. I'll follow that into the optic disc as well. Raise the lights. Okay, next is your nose. If you will occlude one side of your nostril, there you go, and blow, and then do the other side and blow, and that's checking for nasal patency. Your nose is in midline and symmetrical position. I'm going to go ahead and palpate those frontal and maxillary sinuses for tenderness or masses. Okay, now we're moving on to your lips. And I'm going to have you open your mouth in a minute, and I'm going to look at your gum, your teeth, your tongue, the base of your tongue. I'll be looking at your buccal mucosa, your salivary ducts, your posterior pharynx, if your tonsils need to be graded. Okay, so I'm going to get my light and tongue depressor. Okay, if you will open and say ah, ah, and then lift your tongue and move it side to side. Very good. Okay, so what I saw there was cranial nerve 9, which is glossopharyngeal, and cranial nerve 10, which is the vagus nerve. That's your uvula and palate or midline on phonation. I saw cranial nerve 12, which is your hypoglossal. Your tongue was without any fasciculations. So now I'm going to be looking at your neck. Of course, it's midline and symmetrical. I'm going to palpate that trachea and make sure it's in a midline position. I'm going to go ahead and look, and I don't see any type of goiter present for thyroid, but if you'll go ahead and swallow for me. Very good. I feel that slide across. Normal size thyroid. And now I'm going to listen to your carotid arteries. So if you will take a breath for me. And no bruise are noted. I'm going to palpate those carotids. Okay, and those are 2+. Now we're going to check for some neck flexion. So if you'll just follow my lead on this, if you'll flex forward and then go back to midline and then extend all the way back, hyperextend, and then touch your ears to your shoulders, and then rotate your neck. Very good. Okay, very good. And now we're going to do the accessory muscle test, which is cranial nerve 11. If you'll shrug your shoulders against my resistance. Very good. Okay. Now we are moving on to your chest. I'm looking at the anterior and posterior chest. I'm looking for any signs of respiratory depression, accessory muscle use, nasal flaring, retractions, any type of tripod position, if you have cyanosis, tachypnea, anything like that. I'm looking at your chest. It looks symmetrical, and I don't see any obvious deformities. I'm going to have you flip your arms or feet around. Yeah. And we'll start here. I'm going to go down to around the 10th rib to check for chest expansion. So if you'll breathe in for me and then just breathe out, okay, that's normal. We're going to check for tactile fremitus. If you'll say 99 every time I touch the back of your back.
99, 99, 99, 99, 99.
Very good. Tactile fremitus is present. Now I'm going to percuss in the intercostal spaces. And I'm hearing resonant lung sounds, or lung tympanic resonant sounds. And now I'm going to listen. Just take a deep breath every time I move my stethoscope. And now I'm going to get your lateral lung fills. If you'll just kind of move your arms forward a little bit. Okay. Now I'm going to check for egophony. So if you will say E every time I move my stethoscope.
E, 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 E.
Very good. And I just heard normal knees, which is or E's, which is a normal finding. It was not muffled. Now if you will say 99 every time I touch my stethoscope.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
And that was checking for bronchophony, which I heard just a little bit of a muffled E, which is a normal finding. And now we're going to check whisper pectoriloquy. So if you'll just whisper 1, 2, 3 when I move my stethoscope.
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2,
Okay, I was unable to hear 1, 2, 3, which means you don't have any type of lung consolidation noted. I'm going to go ahead and now have you turn back around, and we're going to inspect the anterior chest now. We're going to check for chest expansion, so if you'll breathe in and then breathe out. We're going to check tactile fremitus, say 99.
99, 99, 99, 99.
Very good. Okay, now I'm going to listen with, right, starting with here with the bronchial sounds. And as I'm listening, in a real exam, I would make sure and not listen over clothing throughout all of this. I'm going to move on and listen to now your cardiac sounds. So we're going to start with the aortic position, auscultation point, which is right of the sternal border, second intercostal space, pulmonic, second intercostal space left of the sternal border, herbs, third intercostal space left of the sternal border, tricuspid, fourth intercostal space left of the sternal border, and then mitral, which is mid-clavicular line, fifth intercostal space. I would stay here for a minute and listen for the rhythm and rate, but in the interest of time, we're going to move on, and I'm going to switch over to my bell and listen at the aortic, pulmonic, herbs, tricuspid, and mitral. Okay, now I'm going to go ahead and palpate at that point of maximal impulse, which is, of course, the mid-clavicular line, fifth intercostal space. Okay, now I'm going to go ahead and have you lay down for the rest of the heart exam. First, I'm just inspecting. I'm looking for any heaves or lifts. I'm going to go ahead and palpate on all the auscultation points, aortic, pulmonic, herbs, and tricuspid, and then the mitral, feeling for any thrills. And I don't feel anything. We're going to go ahead and listen again, starting with the diaphragm, aortic, pulmonic, herbs, tricuspid, and mitral. And then we're going to listen with the diaphragm, aortic, pulmonic, herbs, tricuspid, and mitral. Very good. I'm going to go ahead and finish with that. We're going to go ahead into the abdominal assessment. So if you'll raise your shirt for me, very good. First, I'm inspecting, looking for any obvious scars, matches, depressions, or any type of lesions. And now I'm going to listen in all four quadrants. And I hear normal active bowel sounds. I'm going to listen for any bruise, the abdominal aorta, which is left of the umbilicus, renal arteries, iliac, and femoral. I'm going to do some percussion now, and it's a tympanic sound. If it was dull, it would mean there's some type of mass or organ. I'm going to do some light palpation, and then some deeper palpation. Now I'm going to and see if I can palpate your liver, if you'll breathe in for me, and then your spleen. And I was unable to palpate them, which is a normal finding. Let's go ahead and put down your shirt, and if you'll turn around that way, and I'm going to go ahead and check for CVA tenderness at about the 12th rib. If you'll tell me this is tender.
No.
Okay. Very good. Now you can go ahead and swing your legs around back toward me. It's time for the musculoskeletal part of the exam. Throughout this exam, I'm looking at your skin integrity. I'm looking at the color, the moisture, any presence of edema. I'm going to look for symmetry throughout your limbs. I'm going to look at your major joints. I'm looking at nodules, deformities, crepitus. I'm looking for swelling, tenderness, or redness. So we're going to start out by palpating all of your joints and your fingers. Very good, and I'm going to check for capillary refill, and it is less than 2 seconds. I palpate your radial pulses, and they are 2+. I palpate your wrist. Okay, let's check some range of motion in your fingers. Just your fingers, and just follow my lead. If you'll flex, extend, hyperextend, abduct, and adduct. And now with your wrist, if you will flex, extend, hyperextend, radial deviation, ulnar deviation, and rotate your wrist. Very good. We're going to palpate the elbows and your shoulders. Okay, let's check range of motion in your elbows. So if you will flex up like this, and then extend, and then hyperextend, and then with your shoulders, if you will flex, extend, and then hyperextend, take it to the back, and then abduct, and then adduct, which is cross, there we go. And then if you will, circumduction, which is just circles. Very good. Okay, now I'm going to check your biceps and your triceps. So if you will, against resistance, so if you will push up, very good, push up, and then push down. Push down. Very good. We're going to check your shoulders. If you'll abduct out, and then adduct in. Very good. All right, let's check your sensation in your upper extremities. So if you will close your eyes and tell me if this is sharp or dull.
Sharp. Dull. Dull. Sharp. Dull.
Very good. If you'll go ahead and open your eyes now, and if you will squeeze my fingers and tell me, very good, and that's a 5 out of 5 hand grip. If you will also, something I failed to do is to thumb opposition, if you will do that for me. Very good. Okay. Now moving on to your vibratory sensation. I'm going to do this on your ulnar prominence. So if you'll just hold your hand out and tell me when you feel the vibration, and then when you feel it stop. Okay.
Mm-hmm.
Feel it? Okay.
And now it's stopped.
Okay, I'm sorry. Put it off too soon. Erasure. There you go.
Feel it and it's stopped.
Okay. We're going to do the medial malleus.
I feel it and it stopped. I feel it and it stopped.
Okay. Very good. That was your vibratory sensation. Now we're going to do to cerebellar coordination. We'll start with serial thumb opposition. So if you'll do this, reverse it, and then do it as fast as you can. Very good. If you will put your hands on your thighs and then flip them and do it as fast as you can. Very good. Now if you'll put your arms out to your side and then bring it in like this, and then now close your eyes and do the same thing for finger to finger. Very good. Okay, now I'm going to check your deep tendon reflexes. We'll start with your brachial radialis. If you'll just relax. Okay. We're going to do the biceps. And then the triceps on this side. And then your patellar. Your Achilles. Very good. We're going to do a Babinski. And plantar flexion up, which is normal, and Babinski. Now we're going to check your sensation since we're down here for your lower extremities. You'll close your eyes and tell me if it's sharp or dull.
Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull.
Very good. Okay, now we're gonna look at your toes. I'm gonna palpate all of the joints in your toes, and I'm gonna check for capillary refill, and it's less than 2 seconds. I'm gonna palpate your dorsalis pedis pulses and your posterior tibialis pulses bilaterally, and they're both 2+. I'm gonna palpate your ankle and your knees. Okay, let's check the range of motion in your toes. If you'll I'm gonna do it with my hands, but if you'll do it with your feet, if you will flex, extend, fan them out, and then abduct in. Very good. And then with your ankles, if you'll go ahead and plantar flex down, dorsiflex up, you're gonna do an inversion, an eversion, and then you're gonna rotate to that ankle. Very good. Okay, now let's check against some resistance with your knees. So if you will go ahead and extend out against my resistance, and then come back in against my resistance, okay? And then extend out against my resistance, and then come back in against my resistance. Let's check your hip range of motion and hip strength. Abduct out against my resistance, and abduct in against my resistance. Very good. Okay, now we're gonna go ahead and have you stand up for me. I'm gonna come over here. Okay, the first thing I'm gonna do is just inspect her hip alignment. And that looks good. And I'm checking her, actually, if you'll come right here so the video can see, I'm checking her spinal process at C7, and I'm palpating all the vertebrae down to make sure she has a nice S curve. I'm gonna have you flex down. And I'm looking at make sure she doesn't have lateral curvature and she's midline. You can raise up, which is a flexion and extend. And then if you will go ahead and extend back for me, and then if you will go to the side, and then if you will do a little rotation. Sorry. Kind of hard to get to a good spot. Okay, now if you'll back up just a little bit and we'll check that range of motion in the hips. So first of all, we're gonna flex, extend, hyperextend, then come back to the middle, and then we're gonna adduct, and you're gonna do an internal rotation, an external rotation, and then you're gonna circumduct, and then we're gonna do the other side. We're gonna extend out, flex, hyperextend, come back to midline, and then we're going to do an abduction, adduction, and then internal rotation, and then external rotation, and then we're going to circumduction. Very good. Okay, now let's check your knees. You will flex and extend, and then hyperextend, and then flex, extend, and hyperextend. Very good. I'm going to have you now walk toward me, so normal rate, and then turn around and walk heel to toe for tandem walk. And that is regular. And then if you will hop on one foot, then hop on the other foot. Okay, that completes our head to toe assessment.